Hello everyone and welcome back to Psychology and Coffee with Aisha. Today we are going to talk about something quite personal, uncomfortable but very important, sexual disorders. And let's be honest, sex is everywhere in the media, but real conversation about sexual difficulties, not so much. So grab your coffee, get comfy and let's discover what are sexual disorders, what causes them, and how they can be treated. Is sex really that important? The short answer is it depends. For some people, it's really important, big part of their life and relationship, and for others, it's not a priority at all, and both are valid. But here is the problem. We live in a world where sex is idealized. We see a certain image in movies, shows, ads that show us sex as something easy and perfect. And that creates a lot of pressure. Because, for example, a couple watches a movie where there is a sex scene and everything just clicks, and that's not the real life. And then they struggle, maybe privately, and they even struggle to talk about what they enjoy. And that disconnect and comparison can lead to shame or even stress. So, what is healthy sexuality? According to the World Health Organization, sexual health means feeling good physically, emotionally, mentally about your sexual experiences. It's about feeling safe and comfortable in your own body, to have an open communication with your partner, mutual respect and consent, no pain, no shame or fear during intimacy. What is a sexual dysfunction? Sexual dysfunction means something is getting in the way of sexual enjoyment and performance. And it's been going on for a while. So that could be low or no sexual desire, trouble with arousal, for example, like getting erected or staying erected, or vaginal dryness, difficulties reaching orgasm, pain during sex. So, for example, if someone avoids sex because it's painful or they feel anxious every time, that's not just uncomfortable. This could be a dysfunction and it's worth exploring. Sexual disorders are common. Let's break the silence. Here is what's more common than what you might think. So for men, erectile dysfunction, so can't get or keep an erection, premature ejaculation, which is called climaxing too quickly, delayed ejaculation, trouble finishing, low desire, just not feeling in the mood. So, for example, a man that feels a lot of pressure to perform, the more he's worried, the harder it gets, literally. That stress makes the issue worse. Now, for women, low sexual desire or arousal, difficulties reaching orgasm, dyspareunia, which is pain during sex, vaginismus, involuntary tightening that makes the penetration painful or impossible. So, for example, a woman that avoids intimacy because she's afraid it will hurt again, that can lead to distance and tension in her relationship. So why do these happen? It's not all in your head. Sexual problem can come from biology, for example, hormonal change during menopause or low testosterone for men, health condition like diabetes, heart disease, medication, antidepressant, libido goes down, birth control for women, the same. Then we have the psychological aspect or reasoning, anxiety, depression, post-traumas will affect low self-esteem, relationship struggles, and fear of rejection. So, for example, if you had a bad sexual experience in your life, your body will remember, and next time you have one, you will be more anxious, and so on. And the last aspect is the cultural and society one, where guilt or shame is there around sex, or unrealistic media expectation, or the lack of sex education. For example, in some culture, you can be raised with the thought that sex is something dirty, and then you will carry that on in your relationship, even if it's a very loving one. Good news! Yes, there is always a good news. There are treatments out there. Even if sexual disorders might feel very isolating, there are super cool treatments. For example, therapy, the cognitive behavioral therapy, which helps shift the negative thoughts. Then there is couple therapy to do together to improve the communication. And then there is mindfulness to kind of reconnect and lower the anxiety. For example, if a couple goes to a couple therapy, the therapist will work with them to improve the communication, to talk honestly about sex and their preferences, where they can both feel that they are reconnected. Then we have the medications, for example, Viagra or meds or different meds for men. And then we have hormone therapy for low estrogen or low testosterone. And then we have pelvic floor exercises for women with pain. And the third one, which is the behavioral technique, this one is based on sensate focus, which is non-sexual touch to rebuild comfort. And then there is this exercise that's called start-stop method for the early ejaculation. And then there is also the exposure therapy to reduce anxiety. So here an example, a woman with a vaginismus might use special exercises at home to slowly and gently reduce pain and rebuild confidence. Let's not confuse sexual differences with disorders. Some people have different preferences or identities. That's not considered necessarily a disorder. Only when a preference causes harm or distress does it fall into a disorder category. A food fetish, it's not necessarily a disorder unless it causes problem to other people and involves someone without consent. Then we have gender identity issues. This is called gender dysphoria. It's a deep stress that people feel when their gender identity doesn't match the biology or the body. But with the right support, many can live in ways that feel true to themselves. And lastly, hypersexuality. It's a condition that goes beyond having a high sex drive. It's really marked by persistent, intense sexual thoughts, urges, or even behaviors that feel out of control, that cause distress and interference with others in a daily life. It's not about judging someone's sexual preference. It's about recognizing when sexuality becomes compulsive and starts to impact work, relationship, or emotional well-being. People with hypersexuality might feel trapped in a cycle, seeking out sexual stimuli for relief, to only feel guilt or shame afterward. And it can be linked actually to other health conditions like bipolar disorder, some traumas, or impulsive control issues. And it's not uncommon. Okay, so let's wrap this up. Sexual health is an essential component of our mental and physical well-being. And sexual disorders are clinically recognized conditions. It's not a sign of a personal failure, okay? And it can be effectively addressed with appropriate support and treatment. And research shows that seeking help can lead to significant improvement in functioning, relationship, and overall quality of life. There is no shame to reaching out. These issues are more common than you think, and help is available. Voila! If this was helpful to you, subscribe for more. Thank you so much for watching. Don't forget your coffee and have a good day.